So talking about the toxic shock syndrome, not really the general toxic shock syndrome. Toxic shock syndrome is mostly caused by a streptococcal species, or it could be non-streptococcal. So this one we're talking about the streptococcal one. That's the one that can be caused by the streptococcus type of organism. Yeah. So for the streptococcal toxic shock syndrome, it's a rare but actually life-threatening condition. So it's caused by toxins that are usually produced by the Group A Streptococcus bacteria. You get? So it's a rare form of invasive streptococcal infection that actually progress rapidly and actually requires like immediate medical attention. So looking at the whole key features, um, we're saying for the symptoms, it can involve all those fever, chills, muscle aches, nausea, vomiting, and all of this you actually be seeing is just within 24 to 20 to 48 hours, right? So it can lead to what? Low blood pressure. So you'll be having hypotension. Your heart will be beating so fast. Then you'll be breathing so fast. Okay. Then you know so many organs are now involved. It can actually okay. Then many organs can now be involved. It will now cause organ failure. So causes is usually the group A Streptococcus bacteria. So they invade deep tissues of the bloodstream. They produce toxins that usually trigger a systemic inflammatory response. So risk factors, if you have open wounds for viral infections like other than chicken pox, have conditions like diabetes or alcohol use, that one is basically what? Depreciating your immune system. You get. So management is immediate hospital like hospitalization. You get. Then you resuscitate the patient. They use all those antibiotics like all this penicillin, clindamycin. Okay. So complication, if you leave it untreated, it can now lead to shock. Shock that we discuss in physiology, right? Yes, it's the same shock that we're talking about here. All right. So it can lead to shock, organ failure, death. Even with treatment, mortality rate is still high. Okay. So that's a streptococcal toxic shock syndrome.